they get infected with infections that they aren't usually as strong, like the skin bacteria that are normal for normal people, but they get a pneumonia of these normal bacteria. So when we look that type of pneumonia, or maybe urinal infections,
Yeah.
we have to discharge that they have a immunodeficiency um, illness. If they come very sick with normally type of infections,
Mm-hmm.
so we have to check that leukocytes levels, because they maybe go to the SIDA stage. I don't know if in English it's SIDA. Let me see.
HIV is the virus, but the condition would be SIDA, right? Okay,
Yeah,
but I
it's
think
in,
we can use the same
yeah,
name.
yeah. SIDA is it's the last stage of HIV.
Yeah.
So they come very, they had lost weight, they had a skin problems, they don't tolerate good the foods, they have all type of problems. So maybe they go just to it depends to palliative treatments, maybe, because it's we can do almost anything in that stage. We just have to take care of that person of everything. They have to manage very well their foods. They cannot get any contaminated product in their house. So it's like living with COVID. You have to be very
Yeah.
careful with everything that you
Okay.
touch and what you eat. So, well, that would be the management from general.
Okay. So the word we were looking for is the AIDS. Okay. It's most common to use that for SIDA.
AIDS. Yes,
AIDS.
yes, yes.
Yeah. I
Yes,
just remember to.
yes. That will be the last stage of HIV. So,
Yeah.
yeah, it's sad. Mhm.
Okay. So, well, if you have another patient with another illness, okay, or problem like depressive illness, that comes to your consulting, what it would be the management? How do you, what would you do in that case?
Well, we always do two-side treatment. One side is the therapeutical, psychological type of treatment
Mm-hmm.
that they had always to do. They for sure had to do that. And we have the medical treatment that maybe be accompanied by by pills and anxiety pills, depressed pills to treatment. But that's not a requirement. But the psychological treatment is a requirement.
Okay.
So it depends. We have to always find out what was the trigger of that depression. That's the most important thing. Like I just broke up a relationship, I got divorced, or I'm feeling old. That's the trigger, and it's very dangerous when we don't find that trigger, because we cannot work on that spot. So that's the beginning of the treatment. And then if we find that they can fix it by themselves,
Mm-hmm.
so we just do the psychological treatment. They have to go to the psychologist. They might not go to the psychiatrist.
Okay,
So
at
they,
first.
at first, yes, if they don't have it, a really strong depression, a major depression, so they go and they go and they progress. And if they don't progress, they had to go to the medical treatment with a psychiatrist, and we have to treat with a medication maybe. But it's the last source.
Okay. You mean in the major depressive illness?
Yes, in the major depression, we have to work with medication because they put their lives on
Risk.
danger, on risk. So it's something we have to treat immediately.
Okay, that's good. Okay, so let's talk another topic. Okay,
Okay.
maybe you know the name of the tendons, reflexes, or something, some sign that you can tell me about. Okay, what is your diagnosis for the patient if they have this problem?
Tendinosis, like
Like
oh,
tendinitis or
that
something like that?
tendinitis. Yes.
Yes.
Well, they it is very painful, so they had to go with analgesics, analgesics, and I think maybe dexamethasone, 8 grams every 8 hours maybe, because it's really painful. It's a very contracted thing, so they cannot stop it because it's pushing all the muscles. So they had to be a long time. When we talk about tendinitis, we don't fix it in 2 days, so they had to be long time treatment. And
Okay.
so maybe in 6 months they will have recovered the normal movement without pain. And yeah, it's not something really really fast to recover.
Okay, Carla. Thank you very much.
Thank you.
I will send to you my little questionnaire. Please,
Okay.
would you fill it?
Okay, it's done.
Thank you very much. I will take a
Thank you.
picture and I hope you have a great week. See you next week.
Okay, thank you. Good afternoon.
Good afternoon. Bye.
Goodbye.
Okay. Hi, Liz.
Hi, teacher. Good afternoon.
Good afternoon. How are you?
Pretty good, teacher. What about you?
Fine, thank you. With less work.
Let's work. That's good. I think.
Yeah, yeah, that's really good. Okay, so let's start because we really don't have enough time to talk, right?
Yes.
How would you manage the treatment for of a woman in her 22 years, for exactly that has cardiac disease?
Yeah. Um. But first of all, I will have to do a good physical examination,
Mhm.
especially the cardiac system, if she has cardiac problems. Um, then, well, I think I ask about some if the patient have signs when she has that problems, and maybe if some, for example, maybe mother or father have cardiac problems too. After that, I will ask some laboratory tests to see if the heart is good. Maybe if doesn't exceed uh, levels of damage of heart. And I will definitely ask electrocardiogram. That's to see why is the heart, is the function of the heart. And now the cardiologist ask an echocardiogram too. The cardiologists think that the echo is almost most important and specifically than the electrocardiogram. But of course, the electrocardiogram is more cheaper. And
An
when the
electrocardiogram.
is more cheaper, the echocardiogram, I think it costs 100 more or less per exam.
Wow.
Yes.
Okay.
And after that, when I have the results, I will check and decide if I can try it. Well, I give some treatment, maybe with some medicamentos, with any pills,
Medication or
medication or
drugs?
pills, or
Where
drugs.
we can use drugs here. Uh-huh.
And if I think this is more complex, I will refer the patient to a cardiologist.
Okay, that's really good. So, what about another topic? For example, describe. Imagine you have a patient with HIV. Okay, in your countries, what would be the management for this patient? Describe a situation.
Mm, like how I
With,
handle it
yes, with AIDS.
with withdrawals or notice or in what way?
If you have a patient with HIV,
Uh-huh.
like how would you manage that situation? What would be the treatment, the management? What would you say to him? How would be the treatment if it's needed or not?
Well, first of all, it's complex, but I think I will tell that explain that he or she has that situation and it's okay. I am not going to tell anybody because that information is confidence, is confidence,
Uh-huh.
and
Confidential.
he, confidential, exactly. And only he or she have to decide if want to tell someone. But I will tell to the patient that he has to make serial controls, come to the consult very frequently because I will have to check how is he or she um, several times, maybe per months or anyway. And I think I have to explain that the HIV is it can be infectious for someone else, so the person has to be careful, and that if he or she wants to tell somebody, maybe I will be able to he or she bring that person to my consultation to explain, for example, the risk and protection or prevention. The most common, for example, you cannot infect a person only with a kiss. But if you don't have, for example, caries, ¿cómo es?
What
Caries,
was
en inglés, ¿cómo es?
cavity? A cavity.
Cavity?
Yeah, a cavity or caries, it's the same. You can use both.
Okay. So if for example, if the partner don't have cavities in the teeth, the HIV won't be infectious, for example. If they are gonna want to have sex, they must have to use condoms or protection. And of course, he or she needs treatment the most recently possible. Has to take treatment so many pills, but don't worry because I know the treatment is very long, but he or she has to be constante.
He has to be determined. No, no, it's not the
or,
same.
or disciplinado tal vez,
Discipline.
or yeah, has to be disciplined with her treatment, for example. In he or she has to change the lifestyle, and maybe the complications will be less.
Okay. So the word we were looking for, it was constant.
Constant.
As easy as that. Okay.
Okay.
Okay. Yeah, I think it's very risky to treat those patients, but at the same time, it's very difficult to find out or not that they have that disease.
To discover the disease.
Yeah.
Um, I think more or less because now the law says that the patient can decide if he or she wants to make the exam, and he or she has to firmar un consentimiento. I don't know how
Yeah.
is it in English.
Let me see. Consent.
Y firmar,
Lying.
yeah. And so the patient has to sign a consent if she or he wants to make the exam. If the patient doesn't sign, we can do the exam.
Okay. But you can notice by just looking some signs in her or his body at the
At the
yeah,
beginning, no, no, it's very difficult.
yeah, I know. In dentistry, we have a common sign that make us notice that the patient might have this disease. Is
Really, which one?
Kaposi sarcoma or sarcoma de Kaposi.
Ah, yeah, Kapos.
Yeah, and it's a very common sign of this
Mhm.
trouble or disease, and it's that we can notice, but not all of them has it, right?
Yeah, that's true.
So it's really it's difficult. We
Yeah,
have to
it's
be
like, for
careful.
example, if you see a person who has the skin yellow, you maybe think, oh, he or she has hepatitis,
Yeah,
but not with HIV. I think we can notice more in the more advanced stage or steps.
yeah, stage, it's okay.
Mhm.
Yeah, I agree with you. Okay, so let's talk about another topic. Do you think, well, if you have, for example, a patient with some major depressive illness,
Mhm.
which would be the management in your consultation?
Well, first of all, I think I will try to talk to the patient and try to find the cause of that problem, because some doctors only give drugs,
Yeah,
and I think that's not a solution. I think if you can talk with the patient, and if the patient have a trust in you, maybe you can solve part of the problem.
yeah, that's true. That's true. I knew about some friend that when he was young, he
Mm-hmm.
has some problems of, I don't know if anxiety maybe, I
Mm-hmm.
don't know, but they were he was uh, given a treatment like alprazolam
Ah, okay.
and fluoxetine,
Yeah.
and I think it's really hard for him because he can get, I don't know, I think it was like a real drug for him. I don't know if he gets better.
And
I
it's
don't
sad.
live with him anymore.
Yes, and I think it's pretty sad to see someone just sleeping by drugs because no, I don't know, some problem.
Yeah, like you said, I think it doesn't solve the most of the problems that the patient can have. So maybe try to talk to him or her. It would be better.
Yes, but I think it's very very difficult. I think that the any person or doctor who treat that
Mhm.
has to has to have too many experience because maybe the person have a real depression, but I know about person who uh, chantajear, ¿cómo es?
Mm, let me see.
Let's see,
Okay. Blackmail.
blackmail, just only blackmail with death. In for example, a woman say to the boyfriend, "I'm gonna kill me if you leave me."
Yeah.
This is difficult.
It's the most common, I think.
Yes.
Okay. Okay, Liz. So thank you very much for your chat, your answers. We'll send to you my questionnaire. Oh,
Okay,
there is it.
done it.
Okay, thank you very much. So have a great weekend and see you next week.
You too, teacher. Thank you so much. Bye
Thank
bye.
you. Bye. See you.
Good afternoon, teacher.
Good afternoon, Salome. How are you?
I have good news. I'm really happy.
Really? Tell
Yeah,
me.
you remember that I told you that I went to for look at job that they called me. So now
Yes.
I have a job in the military hospital, and I'm really happy. Just be a little tired because try to remember all the things that you known in the university. It's really hard, but that is good. I'm really happy. So yesterday, I when I joined to the class in the car when I was arriving at my home, I was
Yeah.
arriving to the hospital. So that is, I am really happy and just a little
Oh,
tired, but I'm happy.
that's really good. I'm so happy for you. Congratulations.
Thank
I'm
you.
proud of you. That's my student.
Yes.
Yeah. So that's really good. It's a good job, I think.
Yes, I'm just a little worried because I don't know where is the area that I will go.
Mhm.
But at the same time, I am relaxing because if I will go to Kobe, I will be okay. I know because I trust in God and I will be very careful about all that things and I will be okay.
Yeah, I think the same, and that's a good thought.
Yeah.
So, and if you go to some place you maybe don't like very much or something, you will learn. So it
Yeah.
will be better otherwise. Okay.
Yes, teacher. Thank you.
Okay. So let's talk about yesterday's topic.
Sure.
Okay. I will make you some questions. Okay.
Sure, teacher.
Imagine you have a young patient, maybe 22 years old, and she has a cardiac problem. And I know the management of the doctor will be determined, but you, what would you do with this patient, or what would you indicate to this patient?
Okay. As a nurse, I will firstly, how I told you many times, I trust on God. So
Yeah,
I will talk with her about sometimes God do something or permit something that happened in our lives for something, for uh, for
for a reason.
for a reason, for become to be really strong, a very trustly person, and for that way I started. But at the same way, I will explain her what is the problem, physiologic problem, because I think if you explain the person what is happening in her body or what is happening with the disease, is better than only say you have to do this, and not the reason.
Yeah.
I think that for a second. Third, I will which cares or which medication or which things have to she has to do the good things, and maybe the prognostic, but the true. What
Mhm.
happens if she doesn't do the things that team, the healthy team tell her, and what is good or bad, and what is the probability of her life, the normal life, all that things. I think sometimes I went a patient, I being a patient, so I know what is the feeling when you didn't know what is happening, and it's only like um esconder. How do you say esconder?
To hide.
To hide the thing, the real problem. So for that way, and after that, tell her for that way for the health thing, but for other way to the prognostic is not good, and maybe she will die in many months. Say that try to live a good life with her parents, try to forgive the person that maybe hurt her, and that she be in peace for die, and try to be closer for God, something like that. uh, and that
Okay. Yeah, that's really good. I think the patient needs support, more if they are going to the doctor by herself or himself, right? So that side of you, that human side of you is it's very good. I totally agree with you. Okay, so another situation. Imagine that come to the hospital or go to the hospital in that case, a patient with HIV. So what it would be the management?
be
What would you
IGT.
manage? HIV, AIDS,
I
like VIH, SIDA,
Okay,
okay?
so that is really hard, especially when have the person have a wife or child. The same way, if he the person failed their husband or her wife, and get that infection for other ways, that is really hard to talk. But if some person come to me, say as I said, always true, but if the wife or the couple of that person didn't know, try to say that the person has not must say the couple firstly, because it's really hard. I don't know how try these things, but try to be in the hospital. it's really hard for that things in the hospital. The person who tells the this diagnostic is the medic with the psychologist.
Yeah, I
Just
think.
like a cancer, because it's really hard that you can say that, and you don't know how the person take that notice, because I think the person who has have this notice will be depressed or really
Yeah,
worried. I don't know, maybe worried about what happened with my wife, what happened with my sons or daughters in the future. They will be alone, they will be okay. So that is full uh, thinking about that. But I try to be sincerely with that person, with the patient, and advise them how to live in a good way with that. And at the same time, to trust in God, try to pray a lot, and be strong, and all kind of things.
yeah. I think it would be really helpful. So, and as a nurse, and you don't have to treat them, right? But you should do some management with the patient. I don't know if you just have to be in touch with them.
Sure, when they are at hospital, like a patient, because the persons with this disease, the most of the time, join at hospital because they are sick, but not for that disease. The BH is because they have a low defense, and they get whatever disease really, really easy, especially a respiratory disease. So when they are at hospital and have two medication intravenous, I need to make the via the for pass the medication, and for that way, only that is the risk that I am exposing how as a nurse. But
Yeah,
I am in the start, when I was a student, I am really afraid about that. But we how pass the time, I'll be more fresh, more relaxed. I am trying to
to be careful.
be careful, polite, because it
Yeah,
really is not no fault. It's true that sometimes people discriminate this kind of disease who have. So this is really hard because we are humans, and
yeah, because they are afraid, I think, of contaminate something or get the virus. I don't know. Even though they know that they have to be careful and nothing else happens, right? Okay, so thank you very much.
yeah.
I have another situation. Okay, this is related to a major depressive illness. Okay, let's suppose that a patient go to your consultation or where you're working with these problems. So they need help, but maybe the doctor is not here or there. So what would you do? What would be the management for this?
Okay. Firstly, try to the patient be relaxed, calm, keep calm all the time. After that, maybe sit with the patient and talk about what is the problem, what is in in her or his mind, what is worried that them, and try to only listen all the things that they told me. Oh, listen, listen, listen. After when they finish, and the person be ready to listen to me, I will start to talk. Maybe I don't have the solution, because sometimes the depression is for a really hard situation, maybe in the past, and the person can pass that season of their life. And obviously, how I say, first God, after God, maybe try to give them advice for solutions, or have to be strong for past this time of her life, um, all the things. And I will pray with that person after. And finally, I will say that maybe I give them my number, cell phone, for call me or told me something, and don't. And the most important thing in this case, I think, is not judge, because when you judge, it's really hard because sometimes I happen that, and but like a teenager topic, about love and that kind of things. But
Yeah.
it's superable. But when the people start judge you, it's really hard because
Yeah.
always everybody are humans, and sometimes we let persons down and make mistakes. But the thing is not be in the past is okay. Give up, never give up, and continue with your life, fighting, and chasing our dreams, chasing all the objects, all the goals that we have in the life, or something like that. I don't know, depend the situation.
Yes. You're giving support to the patient, in order not to get close, right? Because if you judge her, she won't tell you anything else. So
Hmm.
that would be the management. That's pretty good. Okay. So imagine that you have a patient with a tendinitis, just that.
Okay.
And what is your diagnosis for the patient? You don't know that it's a tendinitis, but what kind of signs he will tell you in order to for you to know that is a tendinitis?
Okay, do let me consult one word.
Okay,
uh,
okay, don't worry.
yeah. Firstly, the paint, allocate paint in the region, or maybe in this case in the hand. Paint when they open, close, push up, or recoger, take the
Pick,
pick, picks the
pick
hand with
up.
the pick
Okay,
up or something like that, and this pain be incremented with the repeat movement, and sometimes we can be oh, we can see a little sling edema, how we told these days,
what? I'm
edema,
sorry, edema
edema, yeah, locate edema.
or
I think for
swelling
that,
or
sorry,
swelling. Yeah.
sorry, for that way I can't think that is a tendinitis. And
Okay.
sometimes in this for this treatment is only anti-inflammatories, uh, cold hot therapy. That is the meaning of try to when we need to use cold for 20 minutes, for example, and after that hot things, maybe a hot towel or cold towel, applicating this in
The
the place
area.
that we think.
Okay. So it might be caused by the patient. I don't know, a fall maybe. He fall down and he just pushed his hand on the floor, and now he has tendinitis.
Hmm. Uh, I think couldn't be possible that because when you receive a really hard impact in the hand, is no tendinitis. It's only for the tendons aren't inflamed. So I think for that way couldn't be.
Okay. Okay, Salome. Thank you very much. You bring me
Welcome, teacher.
a lot of useful information. Okay, I will send to you my little questionnaire.
Okay.
Uh-oh. I don't know if you can see or
No,
nothing.
it's freezing. The screen is freezing.
Yeah.
Yeah, now yes. Okay.
Uh-oh. Oh, there
Okay.
is.
Yes, done, teacher.
Yeah. Okay. So thank you very much, Salome.
Okay, teacher.
We will talk about the other topics next week. Okay, have a great weekend.
Great weekend, teacher. Bye.